He kōna e purangi tēnei nā te reo irirangi o Aotearoa.
I don't know about you, but this is when I first became aware of wastewater testing.
The amount of wastewater tests for COVID-19 has increased across Auckland and New Plymouth in response to the discovery of new community cases of the virus. ESR are now testing daily for COVID-19 in sewer systems.
Turns out it's not the first time it had been used in New Zealand. That was 2016, with a pilot investigating drugs in wastewater.
We managed to measure these two sites, and they had quite different drug profiles as well. One had a fair bit of MDMA, the other had a fair bit of cocaine in it.
Kia ora, nau mai haramai ki te ao hurihanga. Hello and welcome to Our Changing World. Ko Concannon tēnei. Today, how has wastewater testing been used so far in Aotearoa? What else can we use it for? And how can it help us?
My name's Andrew Chappell. I've been working at ESR for 22 years, and the last 6 or 7 years leading the drugs and wastewater team.
Andrew is based at the Crown Research Institute ESR in Christchurch, where he's responsible for running a national programme, in collaboration with the New Zealand Police, to investigate illicit drugs in our wastewater. That pilot started with 2 sites and then they added a third, so Auckland, Christchurch and Whangarei. It showed that methamphetamine was used in high volumes across the 3 locations, with MDMA used in Christchurch and cocaine found mostly in Auckland. Since then, there's been continued tracking of drugs in our wastewater, the results of which get published on the New Zealand Police website. Wednesday morning is sample day, when batches of glass bottles full of wastewater arrive from councils around the motu for processing. We'll get back to Andrew in the lab in a little bit. But first, to the University of Auckland and Dr. Lisa Pilkington, who's been wading into the area of wastewater-based epidemiology.
It is the analysis of wastewater to understand population habits and consumption trends and things like that. So everything ranging from what people how things that they consume to looking at health-related metabolites and biomarkers as well. So analysis of wastewater to understand about the population that contribute to it.
For example, ESR investigating wastewater for illegal drugs and COVID-19 are 2 very different things. One involves looking for specific chemical compounds, the other honing in on virus genetic material. It got Lisa thinking, what else could we investigate that might help communities?
This all began actually when it was this idea of can we expand our repertoire to look at other substances. And one of them that was a particular interest was looking at alcohol consumption. So that was our first cab off the rank.
And taking on this project was master's student Miriama Wilson.
Ko Miriama Wilson tōku ingoa, no Winiata Aho, ko Ngāti Kahungunu ki Wairua, Ngāti Tūwhare Toa, me Ngāti Raukawa, ngā iwi. So the reason we did this research was alcohol is our most harmful drug in New Zealand. It causes the most death and harm in New Zealand, but it is legal. And so we had data, surveys and sales information, but there's biases, and obviously when people are asked how much alcohol they drink, they don't necessarily have to say the truth. Maybe they just don't know. So we wanted to prove in this research which regions are consuming more alcohol and potentially need more support from the Ministry of Health.
Internationally, others were already doing this, so Miriama gave it a go to see if she could make it work in New Zealand. Here's the tricky bit though. To figure out a community's alcohol consumption, you can't just look for alcohol, for ethanol, because maybe someone's just poured a beer down the sink or something. Instead, you have to look for what our bodies produce when we drink alcohol, the metabolites.
In the body, ethanol goes through the phases of pharmacokinetics, it's called, and it gets metabolized by enzymes, so it gets changed chemically, so it can be more water-soluble for excretion into the wastewater, so you pee it out. So it's actually excreted in very small amounts, but because it's well established in the literature, we know back calculations to back calculate to the known concentration of alcohol that is consumed by humans.
She investigated 10 different sites, which represented about 40% of the population.
4 in Auckland, and the rest were from Wairoa, Palmerston North, Dunedin, Christchurch, Queenstown, and Westport. So we wanted to use different locations with different population sizes, and we also wanted, I guess, half from the North Island, half from the South Island. And luckily, probably not luckily, it was during a COVID lockdown, so we did get to see alcohol consumption change during the lockdowns as well.
Oh, so did you have like a before and during, or a during and after, so you had a kind of comparison?
Yes, so it was during 2021, and when we first started, we were in just level 1 restrictions, so pretty much freedom, and then eventually by the end, Auckland ended up in a level 4 lockdown.
Ah, okay. So what kind of time frame are we talking?
We analysed for 6 months, so 1 week from each site for 6 months.
And so did you see a change, like specifically in those Auckland sites during lockdown?
Interestingly, it did not change with level 4, but level 2 restrictions did increase, and it showed that kind of with more freedom we had, the more alcohol we consumed.
Oh, that is interesting. And I guess with these things, you're kind of correlating, right? You can't actually say that this is the cause of what you're seeing in the wastewater results. But when you see any spikes in alcohol, you can kind of look up and see what was happening at that time.
Precisely, that's what we did. And when we did have the level 4 lockdown, we found that kind of the daily trends changed. So we were consuming more alcohol during the week rather than the weekends, where usually the weekends you have a higher alcohol consumption.
Oh, that's fascinating. So you were actually drilling down into like a daily change in consumption.
Yes, so we sampled daily for a week and then for 6 months.
And after the 6 months, there were some interesting correlations that Miriama found in her results. And she was also able to compare places too.
Because we knew the population sizes of each of the locations, we could then divide that by the population to give a sort of per capita alcohol consumption per person. So then we could compare locations. And then we found certain regions were higher than each other. South Auckland was the lowest and all that. And I love proving that and just proving all the stereotypes about South Auckland.
The highest per capita was Westport, followed by Queenstown. In general, averaging across her measurements, Miriama found that rural areas consume slightly more alcohol per person than urban areas. She worked out the overall average alcohol consumption as 12.2 millilitres per person per day, which is pretty much bang on 1 standard drink. But she also found some interesting peaks, some that coincided with sports matches, All Blacks games or Super Rugby games, and one big spike in Queenstown.
There was a one-night-only stripper event, male stripper, and that was their highest value for that day.
She could also see changes in the patterns around long weekends.
Queen's birthday at the time and Anzac Day. So that proved that the Sunday before the public holiday, people consumed more because they knew they had the next day off.
For Lisa, identifying these patterns in this efficient way that doesn't require any time, cost, or commitment from the public is one of the benefits of this kind of research.
Before now, we had ideas from sales data and sort of surveys, but to really dig down into on what particular day, what kind of alcohol consumption levels are you getting, that information prior to this study was not available. Also, when you look at things like for alcohol sales data, that's how traditionally information is gained, but that's when things are sold, that's not when they're consumed, So it's just really digging down into community habits in a non-targeted way, in a broad way, but something that just gives you a lot of information that you can do to potentially have such great positive impact for the community.
Now, Miriama's study only ran for 6 months, but if you set up monitoring long-term, it could help researchers understand whether interventions work or not. There's this example from the Northern Territories in Australia, where they implemented a minimum unit alcohol price policy in October 2018. What this meant is that the cost of 1 standard drink was set at $1.30. Before this, the cheapest drink had been cask wine at 70 cents per standard drink. So, prices went up. They'd been tracking alcohol consumption in wastewater since August 2016 and continued looking at it through the change and afterwards.
There was an immediate effect, but then things slowly crept up again. So increasing the cost of alcohol, or at least setting a certain value that it had to be, meant that immediately there was a decrease, but it wasn't a long-term trend, and they saw that actually it started tracking back to sort of pre-change levels. And again, that's really interesting information that you wouldn't necessarily predict and you wouldn't necessarily know without this kind of study.
Te Whatu Ora have shown some interest in Miriama's results, but there's been no decisions yet on whether to do this kind of monitoring long term. In terms of the logistics, the nitty-gritty of how the research happens, we have to head, as Miriama would have done, to that ESR lab in Christchurch, where Andrew Chappell is based. Andrew helped Miriama process her samples in a dedicated lab space decorated with colourful Kerry street art where the Drugs in Wastewater team work. Our Changing World producer Ellen Rikers headed along to meet Andrew as he and the team got stuck into a newly arrived batch of samples.
We get over 200 samples coming in every month, so we have to split that up into 3 groups, 3 weeks, just so we can handle the amount of wastewater coming through. So these are the chili bins that the samples arrive in. So we send those out with empty bottles and they come back from councils that have collected samples for us. 7 bottles of wastewater, 1 for each day of the week.
And how big are the bottles?
They're a litre each. So we have a litre of wastewater. It's been collected by council staff at the treatment plant using an auto-sampler, which collects a small amount every 15 minutes or so. So we get a representative sample over a 24-hour period. And that means we don't miss anything from, one person flushing and so on. So it's important that it's sampled really well, and we rely on the goodwill of the councils to help us out with this.
The wastewater shows up in 1 litre brown glass bottles, which the team will clean thoroughly and then send back out to be reused over and over. First step is filtering.
So this is the setup where we do the filtering, and Sarah there is actually filtering some samples.
Right, so it's a big conical flask, and then on the top you've got the filter and you're pouring it through?
It is, and the filters get blocked up fairly quickly, so we have to use several filters per sample. So it's a fairly slow process. So we have to swap the filters out and then put some more of the wastewater in there. And at the end we get something that's reasonably clean. It doesn't look clear, but at least it doesn't have any solids in there.
Right, and when you say solids...
Not the solids you're thinking of, no, we're talking about smaller... I mean, there's the odd bit of corn that we see coming through, which is good fun. You get the odd pea, but no, usually it's a bit smaller. We can probably go and have a look if you...
Yeah, absolutely.
So you can see on the filters here, they go quite brown, and it's sort of a muddy sediment type thing rather than real solids.
Yeah.
So different colours from different sites, and it's quite interesting. Occasionally we'll get ones that are purple, but usually they're various shades of brown.
What is the purple?
I don't know. We were wondering that too. Maybe a beetroot was in season.
And do they smell when you open them up?
They do. That's why we've got lots of ventilation in the lab here. So we've got 3 fume cupboards. As you can see in here, I mean, these bottles are open and we're filtering, but it doesn't smell too bad at the moment. But yes, if we just did open them in the environment without the ventilation, it wouldn't be very pleasant.
All right, so you filter them and you've got this liquid that I guess kind of looks a bit like pee.
Yeah.
Maybe slightly less yellow, but discoloured water, really.
A light beer, maybe.
A light beer, okay. And what's the next step?
So the next step, that's preparing the sample, I suppose, for the lab processes. We move to a different fume cupboard over here where we actually measure out the amount of sample that we want to use. So we need to measure that quite accurately in order to be able to work out the concentration later on in the process. So Catherine here is adjusting the pH of the samples, so that's really important for the chemical process for extracting the samples, that we have an accurate pH. And then we put an exact amount of 220 mils of wastewater in there for the next process.
And so then next process?
Over here.
Yep.
Once they have this precise amount of filtered wastewater, it's onto the solid phase extraction instrument. This sucks up the water and forces it through a cartridge that has a particular powder inside, which is specific to what Andrew is focused on, finding illicit drugs.
The particular chemistry of it means that the drugs that we're interested in, the drugs and metabolites, stick onto the material while the rest of the wastewater goes right through and out to waste. And so this means that we get to not only clean up the samples, but we concentrate them as well. So we load 200 mils of our sample onto these cartridges, and then we wash it off with a solvent, and we end up with about half a mil at the end. So we've just had a 400 times concentration step.
The instrument they use for analysis is quite particular. So this 0.5 millimeter sample then gets fully dried out, resuspended in a different solvent, and then given a hard spin to get rid of any tiny solids that might still be in there. Finally, it's ready for analysis.
So this is our liquid chromatograph mass spectrometer. What this does is we take a really small, only 2 microlitres, so that's 0.002 of a mil, and inject that into the system, and it goes through a column which separates each of the drugs that we're looking for. So in our sample extract, it's all mixed together. So we want to separate that into its individual components, and then that comes through into the mass spectrometer here. And so we're able to identify the drugs by their individual mass. So they've all got a different mass depending on how many carbons, how many nitrogens, how many hydrogens are in there, for example. They've all got a different mass, and they're also the time that it takes to go through the system is different. And so we've got 2 ways of confirming that it is the drug that we're interested in, so we can be really confident that we've identified the right thing. And then depending on the response of each of those drugs, depends on the concentration, and we can calculate how much was in the sample in the first place.
So which drugs are you looking for?
The main drugs we're looking for are methamphetamine, MDMA, cocaine, heroin, and fentanyl. So we're looking for the main drug, the parent drug, but also the metabolites. So that's the substance that it's converted to in the body and excreted in urine. And so that helps us to confirm the difference, or tell the difference between whether the drug was consumed or, for example, dumped during a raid or during manufacture or something like that. Because what we're really interested in is finding out what people are using. So it's quite important to be able to tell the difference there. And we've just recently started to look for some of the new NPSs, or novel psychoactive substances. So these are, they're commonly called bath salts, but synthetic cathinones. So the synthetic ones that are constantly changing, they're an evolution of the legal highs that we used to have back in the days. So ketamine is one that started to be used a little bit more, but then also dimethylpentalone, utolone, and those sorts of things. So we're finding some really interesting results here where some of these are really popular in New Zealand and not used overseas when we compare our data to overseas data. So
How many samples would have drugs in them?
it depends what drug we're talking about. Thankfully, we hardly ever see any heroin metabolite, which is fantastic. And I've analysed some samples from Australia, and we have seen it, but we tend not to in New Zealand samples, just extremely low levels, if at all. But when we're talking about methamphetamine, which is a big problem in New Zealand, obviously, every single sample we've ever, I think we're over 20,000 now over the last 5 or 6 years. Every sample's had some in, at different levels, of course, different concentrations, but yeah.
So this raw data tells them about the presence and quantity of these different drugs in each sample. And then the team does some maths to make the numbers a bit more helpful. So they work out an estimated consumption amount. To do this, they use flow data from the councils and also an excretion factor for the particular drug, so that they can back calculate, much like Miriama did. Then they'll also normalise for the population of the catchment to get that per capita number. This information then gets sent to the police, to the National Drug Intelligence Bureau.
We give that data to them, and they have a lot of other drug data sources, for example, street prices, confidential informants. They know about seizures from customs. And so this is just another piece of information that they can use to understand the drug economy. But most importantly, the main purpose of this is to a more efficient allocation of limited resources, I suppose. So if there's only enough money to put a addiction service in one town and one area, we can potentially identify where it should go.
Right, yeah.
And we can also measure the impact of these interventions as well, because we're measuring every month over time. So that's the real power of this technique, is looking at long-term trends and seeing the impact of multiple things, whether it's the COVID lockdown or whether it's an arrest or a seizure at the border.
And look, there's a whole heap of things they found out from this work. We'll make sure to follow up with the New Zealand Police in another Our Changing World episode to delve into that. But in this lab, it's a well-oiled machine. Today, the National Drug Screening Programme covers around 65 sites, which represents 75 to 80% of the New Zealand population. From the initial pilot of 2 sites in 2016, it went to national scale of 37 sites in 2018. Here's Susie Ferguson, back in the day, before wastewater testing was in our daily news.
This might not be the most pleasant thing I've ever had to say on the radio. It's been termed one large urine test. A national wastewater drug testing programme for meth, cocaine, heroin, ecstasy and fentanyl.
Oh, Susie, just you wait. But what this meant is that a sampling system in those relationships with the councils were already in place by 2020.
So it was good timing because we had started our national program, so we had a lot of contacts at different councils around the country. And that was one of the hardest parts, just finding the right people to collect samples. We can't collect samples, we do rely on councils to do that for us. So when COVID happened, we got on the phone. We were spending long days on the phone, but we got that up and running in about 2 weeks from when we decided this is something we could do, and the lab in Wellington, ESR, had the capability to do that, to when samples were arriving, and then everyone knows it was on the 1 o'clock stand-ups from then on.
Wastewater testing is playing an important detective role around the country as health authorities race to find out whether COVID-19 cases have spread from Auckland.
Now, the sampling and sample processing by the lab in Wellington will be quite different to what they do in Christchurch, because they're looking for different things. And Miriama Wilson's process to investigate alcohol consumption would have been slightly different too. But she piggybacked off this established system.
Lisa got in touch with me a few years ago and said, I think the work's really interesting. I'd love to work with you on some other things. And I guess for me it's really exciting because we've shown through the drug program that there's so much information in wastewater. And most of it's just being flushed out to sea. We're intercepting the drugs at the moment to find out what's going on there. But there's so much else in there that could help us understand, again, the health of a community. And so, yeah, I'm really, really excited to be working with Lisa and her students on different aspects. And so, yeah, Miri was looking at alcohol consumption, and we've got a whole lot of samples coming in every week. And we don't use all of it. We use a lot of it for our drug extraction, but there is some left over. And so with council's consent, of course, we can use some of the leftover samples for these other projects, which is really interesting. So it's no extra effort for anyone. We can just put some of these samples aside for students to come in and use for their projects.
Miriama's master's research is all written up now, but she knows what she wants to investigate next.
I'm continuing with wastewater-based epidemiology because it was so much fun. And so we're looking for health biomarkers now. And I've chosen the biomarker prostate-specific antigen. So it's a biomarker for prostate cancer as well as prostate health. And so the reason I chose this was prostate cancer is our highest cancer type in New Zealand, regardless of gender. And it's also our second biggest killer in men, in New Zealand men. And I guess my own personal experience, my grandfather passed away from prostate cancer, and that's probably one of the reasons that I chose prostate cancer. And it hasn't been analysed previously around the world, so this is a world first. Hopefully we can detect it, but we have got methodology, and we are excited to detect prostate-specific antigen in New Zealand.
Oh, I'm sorry to hear about your granddad, but that's from a personal point of view, how cool that you're able to use your skills and experience to be able to address this specific problem.
It feels very personal, as well as the fact that we know that Māori men are dying at twice the rate of non-Māori men in New Zealand from prostate cancer, and that's because of the known worse health outcomes for Māori, as well as the fact that they're more likely to live in rural areas, and that's further away from healthcare services, and there's increased costs for transport to those regions with healthcare services. And so it feels very personal, this research, and I'm very excited for it.
Lisa and Andrew have been supervising other students too. Another master's student, Hye-young Kim, has done some preliminary work looking at vaping and smoking.
She has looked at trying to understand nicotine consumption in New Zealand, and also trying to understand sort of the varying contributions from smoking and vaping to nicotine consumption. So we have finished the data analysis or the data collection. She's done the sample analysis. We're now writing up that research and really looking at the numbers to see what we can find out.
To do this, Hye-young looked in the wastewater samples for 2 metabolites made in the body when it processes nicotine. And she also looked for specific compounds you only find in tobacco leaves, which let her distinguish between cigarette nicotine from tobacco and vapid liquid nicotine made in a lab. And Lisa's got other ideas for research too, looking for environmental contaminants like harmful compounds in plastics, to understand what our exposures to these might be. Now, wastewater-based epidemiology does have its limitations. For example, because you don't have individualised data, you can't tell whether a signal you're picking up is a small number of people consuming a large amount of something, or whether it's a large number of people consuming a small amount. But Lisa thinks the group anonymity is one of the benefits of this method, amongst others.
You can get a wealth of information at a population scale about what's happening in the community, and then you can do that in a very quick and efficient, near real-time way. And then you can offer that support in a really immediate or very responsive way to anything that might be emerging in the community.
Thanks to Dr. Lisa Pilkington and Miriama Wilson from Waipapa Taumataro, the University of Auckland, and to Andrew Chappell, Senior Scientist at ESR in Christchurch. Thanks to producer Ellen Rikers for interviewing Andrew, and this episode was produced by me with help from Phil Vine and Ellen. Sound engineering was by Mark Chesterman and Phil Benj, and Liz is executive producer of Our Changing World. And heads up, Season 8 of RNZ's Black Sheep is well underway now. Across the years, this show has accumulated a veritable dragon's hoard of awards, and for great reason. Make sure you get involved. Search for it on your favourite podcast app and follow the show so you don't miss an episode. Tēnā koe I whakarongo mai. Thanks so much for listening. Ko krea Concannon ahau. Have a great week. Kia pai, te wiki.